So I just wanted to address and answer another very commonly asked question, a question that comes to me, and I know it comes to a lot of my colleagues as well, to do with hip mechanics, squat mechanics, but this one is particularly to do with hip flexors. So hip flexors are another one of these muscles that we hear a lot of, another one that's very popular for people to stretch or complain of feeling tight. You know, I've got tight hip flexors, therefore I can't do whatever it may be, most commonly squatting. So I thought it might be helpful to have a little look at the functional anatomy of a hip flexor, what it does, what it doesn't do, and then hopefully give a little bit of light and understanding to why it might not be the case that they're responsible for someone's discomfort when they squat. So if we look at the position and attachment sites of a hip flexor, they attach here, so they attach thoracolumbar fascia, so essentially your lower back. They then run posteriorly to anteriorly, so they run from back to front through your midsection, like so. So they run from this attachment site here in this kind of oblique angle before then attaching to the femur or the thigh bone, like so. So when they are contracting, they produce this action, so hip flexion, hence the term hip flexor. Now, if we understand where they attach and we understand where their lines of pull are, we then should be able to see quite clearly that when somebody goes through this action, so hip flexion, or goes into a squat or into a knee drive or anything similar, anything that replicates that, that muscle, that hip flexor, is getting shorter throughout that motion. Okay, so whether it's active in that action or not, it's getting shorter. Well, we would like it, in my opinion, it should be very active during that action. I think a hip flexor should be active. It should be actively contracting as somebody descends into a squat. That should be a controlled action. But even if it's not, it will be getting shorter. It has no other choice. All right, so that discomfort that people sometimes feel in this part of a squat, they're getting into that sort of deep hip flexion. And often people will observe or complain or be told, oh, you've got tight hip flexors. That's what that is. That's what that discomfort is in the front of your hip right here. Okay, it's almost certainly not that, right? Because the hip flexor is shortening during that action. So a hip flexor being short or tight would actually, if anything, help that, right? It would help you get there. Right, what is more likely to be the case is that feeling of pinching or discomfort or tightness, as it's often misunderstood, in deep hip flexion is more likely to be a compression of the structures in and around the front of that hip. All right, so there's obviously the bony part of the hip socket, then there are some other passive structures that sit there as well that provide stability to that joint. All right, and if that joint is either misaligned, so that pelvis is tilted way too far forward, or we're just going to an excessive range for this individual anyway, you can then start to compress and crush those structures, right? And that's uncomfortable, that hurts. Right? So when people are in that deep hip flexion coming up here and they feel a pinch in the front of the hip, we should be looking more at what is their alignment doing, where are these bones relative to the other bones, rather than thinking, well, there's another thing to stretch, all right? Because if we are damaging and compressing these passive structures in the front of the hip right here, and then we force someone into excessive extension thinking we're going to be stretching a hip, or stretching a hip flexor I should say, I hope you can see what's going on with that femoral head, that ball here, as I push it back, is it drives forward, okay? It rides forward in that joint. Well, that's a natural mechanical action. So if we've compressed and damaged structures in the front of the hip right here, and they are painful, and then we think, right, well, let's do this, all we're doing is just damaging the ligament from the other side this time, all right? So we're actually making that problem worse. Okay, so hip flexor flexes a hip, all right? So it being short or tight does not prevent you from flexing a hip. If anything, it would help you. But so discomfort during hip flexion is almost certainly not that. Well, we should, as with most things, start with alignment and work out from there.